confused and say, refer to SHIF, SHIA, some tell me SHIA, but today we want to be able to empower you so that you understand clearly when we are talking of SHIA, what do we imply? Allow me to take you down memory lane by taking you through the SHIF regulations. Remember, in October 2023, the government passed into law 4 laws that were critical in anchoring universal health coverage in Kenya. They include, number 1, the Primary Healthcare Act, the Social Health Insurance Act, which was the second. The third one was the Digital Health Act and Facility Improvement Fund Act. Let me take you through the Social Health Insurance Fund general regulations. Now, the areas that are addressed by the regulations include, number 1, the implementation of the Primary Healthcare Fund, implementation of the Social Health Insurance Fund Act, implementation of the Emergency Chronic Critical Illness Fund, which is a new entrant. It addresses issues pertaining to empanelment and contracting of healthcare providers or hospitals that offer services. It addresses the benefit package and the tariffs that are applicable. Last and not least, it claims settlement and general provisions. On the objects of the regulations, the objective is 1, is to provide for the implementation of the 3 funds that I've just talked about, the Primary Healthcare Fund, the Social Health Insurance Fund, and Emergency Chronic Critical Illness Fund. Allow me, Chair, to mention something there. When we talk of SHIA, SHIA is an umbrella body that encompasses the 3 funds, the Primary Healthcare Fund, Social Health Insurance Fund, SHIF, and Emergency Chronic Critical Illness Fund. I want to believe you're enlightened. So when you hear people talk of SHIA, remember they are referring to the 3 funds. And the other objective of the regulation, they provide for registration of all persons resident in Kenya, including aliens, refugees, foreigners, or expatriates who work in this country. Let me take you through the Primary Healthcare Fund. And the purpose of this fund is to establish a pool for receiving and payments of funds. And the key function is to purchase primary healthcare services from primary healthcare facilities in level 2 and 3. Ordinarily, they are referred to as health centers and dispensaries. Now, under the Primary Healthcare Fund, access of care under this primary fund is as follows. In order to access services under this fund, a person must be registered under the Social Health Insurance Fund. I want you to underline the word registered under the Social Health Insurance Fund, because without registration, you may not be able to access services in level 2 and 3 facility. The other key thing is that the person shall access primary healthcare services from the primary healthcare facilities. That is level 2 and 3 as per the Kenya Essential Package of Health, or what we call CAF. Now, what services are offered under Primary Healthcare Fund? The services offered under this fund are basically primary healthcare services as specified in the Essential Benefit Package. They include the following: promotive services, preventive. When we talk of universal health coverage, it means people in our country having access to promotive, preventive wellness services. The third one being curative in level 2 and 3. We have rehabilitative, palliative care, and of course, referral services. Under SHA, we have implemented the National Referral Protocol, whereby healthcare starts at the community level in level 2 and 3 facilities. Allow me to talk about the successor of the defunct National Health Insurance Fund, NHIF. Now, when we talk of social health insurance, the objective of that particular fund is to establish a pool for all contributions under that act, including contributions for indigents who are poor and vulnerable persons, and persons held under lawful custody, whereby we have funds appropriated by the National Assembly. The other key function is to purchase healthcare services for healthcare providers in healthcare facilities level 4, 5, and 6, which are teaching and referral hospitals. Now, when it comes to registration of an applicant under SHIF, the following are the mandatory documents. You have to have a copy of the national ID, passport. If a refugee, we have refugee identification, and for that matter, for refugees, we have a mandate or pass. For aliens or foreigners who work in Kenya, we have a work permit. And the way the act is made that every resident will be required to register under SHIA. This includes all members who are previously registered under NHIF. What has happened? The government went backward. There was an amendment to Section 13 of the SHIF Act, whereby the former members of NHIF were automatically transitioned to SHIF after validation by the National Registration Bureau. The other thing you need to know, once registered, each beneficiary shall be assigned a social health insurance number, which is unique, and every beneficiary shall have their biometric data either captured or, if you are previously registered with the National Registration Bureau, SHIA is going to integrate so that we can, when you are coming to access services, for purposes of authentication, SHIA will use biometrics. Allow me to talk something on registration of children, and we have timelines here. A parent or a guardian of a child, within 14 days of birth of a child, should apply to SHIA for the registration of a child. And I normally say, Mungu akileta mtoto, analeta na sahani yake. In this case, it is the SHIA registration. Now, a person registering a child should carry the child's birth notification document. SHIA will then register the child into SHIF and assign what we call a child minor social health insurance number. When these children attain the age of 7 years, the parent or guardian should present the child at any of the SHIA points of service, Huduma Center, for the purpose of obtaining the child's biometric data. When they attain the age of 18 years, they will be required to apply for updating of their registration details and then be issued with a new SHIF number, whereby they'll be considered a contributor and liable to pay. Now, for registration of beneficiaries under SHIA, when we talk of beneficiaries, we are talking of the spouse, children arising out of that particular marriage, adopted children, and a child for who the contributor is a guardian. And for a spouse, the document we need is an ID for the spouse, and of course, proof of marriage, either by a marriage certificate or an affidavit from a registered commission of oath. For children, the document required for registration for children under the age of 6 months, it's a birth notification. For children above 6 months, it's a birth certificate. For adopted children, an adoption certificate issued by a competent court of jurisdiction. For a child who the contributor is a guardian, a will, a deed, or a court order. For persons with disability, they are required to submit an ID and a certificate of registration from the National Council of Persons with Disability. Remember, under this SHIF Act, the government is obligated to pay for persons held in lawful custody, that is in prison or in remand. The document that that will be required for registration is the prison admission number or remand number. For children in conflict with the law, admission number in either a remand home or a rehabilitation institution or a postal institution will suffice. Allow me to mention something. I did mention that the regulations were recently amended on 19th September through Legal Gazette Notice number 147. Regulation number 13 was amended, whereby it used to read that the former members of NHIF were to be registered afresh. The new amendment, the impact was that all members of NHIF will be transitioned to SHIA as members. This will be done upon verification of their data. Now, when it comes to amendment of beneficiaries, due to various reasons, you can decide either to amend the beneficiaries. And the requirement is that you must submit the following document. In event of you are newly married, a new spouse ID or proof of marriage by bringing a marriage certificate or affidavit, adopted children, a court order, a child with a guardian, a deed issued by a competent court, and in the unfortunate event of divorce, a decree of divorce issued by court. In the unfortunate demise of the member, death certificate. Now, I did talk about the timelines in registration of children, which I'll jump. Now, we also provide for the registration of a beneficiary under SHIF, and a beneficiary shall be deregistered upon the unfortunate demise or death, and the authority shall be notified of their death by the principal registrar of births and deaths, as well as the household of the beneficiary. The household will continue to access benefits for the period for which the contributions were paid for. Allow me to talk something on contributions. This is where the rubber meets the road. And under SHIF, contributions are classified into three. The first cohort is household with income from salaried employment, people engaged in employment, whereby their contributions will be equivalent to 2.75% of gross income paid monthly, and the due date is on or before 9th of the month. The second cohort of contributors is households with income from non-salaried employment. When we talk of non-salaried employment, we are talking of mama mboga, boda boda, juakali artisans, mechanics, retirees. Their premiums will be pegged on 2.75% of household income after means testing. And to say something on means testing, this is an economic indicator tool that assesses the income and assets of a household, and it uses a linear regression formula to determine the premiums that will be paid by the non-salaried households. Last but not least, we have households in need of financial assistance. Under the SHIF Act, the national government and county governments are obligated to pay for the poor and vulnerable households, and they'll pay annually within 9 days from the date of annual contributions that are due, and the government financial year commences on 1st July. For persons held in lawful custody, yes?
Okay. Oh, sorry, we had lost you for a minute. Thank you.
Sorry. For persons held in lawful custody, the national government will pay contributions for persons held in lawful custody, including children in conflict with the law, and they'll pay annually 9 days before the commencement of the government financial year. Allow me to talk briefly on means testing, which is the tool that is used to determine, one, income for the poor and vulnerable, and the non-salaried. Now, the authority will use means testing to determine the household income for households in need of financial assistance and for households whose income is derived from non-salaried employment, juakali artisans, farmers, and mechanics. Now, the means testing tool will be developed by the Ministry of Health and the ministry in charge of social protection, and the tool has been developed and deployed. It is available on the SHIA platform. Once you click that you are non-salaried, it will request you to answer some 20 questions, which are an indicator of your economic, of your net worth, and they will use data collected from household based on various socioeconomic aspects, including your income, the house you live in, acreage of land, and many others. Allow me to talk about the new entrant, which is the Emergency Chronic Critical Illness Fund, and a beneficiary will benefit from this fund only after depleting his benefits under SHIF. He must be a registered member of SHIF with paid-up contributions. However, any person can access emergency services under this act. Remember the provisions of the constitutions that Kenyans promulgated in 2010. If you read Article 43, sub-article 2, it reads that every Kenyan has a right to emergency care. So for purposes of emergency care, you can be able to gain access to this service. But for chronic critical illness, you must be a member of SHIA who has depleted his annual limits of liability. Now, I'll pass briefly through empanelment because my colleague will talk about it. The process of contracting facilities and payment shall only be made to empaneled and contracted facilities, except in cases of emergency, and the authority will automatically empanel facilities forwarded to read by the relevant body, which is the Kenya Medical Practitioners Dentist Council. And empanelment is a continuous process. When it comes to contracting for healthcare providers, facilities shall be contracted in line with the procurement laws and regulations to provide healthcare services as set out in the Essential Benefit Care Package. And the authority may contract facilities in and out of the country. Remember, the SHIF benefit package provides for overseas treatment, and the most common destination for Kenya is India. So SHIA will contract facilities in those foreign jurisdictions. And once contracted, the facility shall be onboarded to the centralized digital platform where SHIA will be conducting its business. Under benefits, a beneficiary under any of these funds shall be entitled to the benefits that are prescribed in the essential healthcare benefits. You remember we have said of the primary healthcare fund, benefits shall be accessed in level 2, dispensary, and level 3 healthcare facilities. Under SHIF, benefits will be accessed in level 4, 5, and finally 6. And emergency services can be accessed from any licensed and certified healthcare provider. I'll jump this because my colleague will talk about the benefit package where the rubber meets the road. Now, the tariffs that are being applied by SHIA were published on 20th September 2024 through the Kenya Gazette Supplement number 71, Legal Gazette Notice number 147, and they contain the scope of cover, the treatment, and services offered. Allow me to talk briefly on a new entity, which is the Benefits and Tariffs Advisory Panel. The reason I'm talking about this panel is because I know some people will ask, how did we come up with this benefit package? It was a consultative process anchored on the Constitution that there was public participation. And this panel shall be established by the CS Health to carry out the following functions. At the beginning of each year, they shall generate a list of healthcare services that to be accessed abroad. They'll review the essential benefit package every 2 years. They'll review the existing tariffs every 2 years, and it will be hosted at a local university. The composition of the Benefits and Tariff Advisory Panel include the following: 1 person from the host university, the Director General, an actuary from the authority, 2 persons from the Council of Governors, and 1 should be a clinical officer, 1 person from HENET, the Health Non-Governmental Organization Network, to represent civil society, 1 person, a development partner, and lastly, 2 persons nominated by the CS Health. And all benefits under the 3 funds shall be paid in line with the prescribed tariffs. When it comes to claim settlement, healthcare providers or facility are given a timeline of 7 days after the discharge of a patient to launch their claims. The claims shall be launched with the authority or the claims management office, or we have the medical insurance provider or claims processing agent. And once claims received, they'll be reviewed. If approved, they'll be submitted to the authority. And all claims will be paid through the digital platform. I'll leave Maria to talk about pre-authorization, which is basically asking for prior approval by the healthcare provider before they administer treatment. And the claims management office will review the pre-authorization request within a timeline of 72 hours and give feedback. And the claims management office may conduct peer reviews when considering pre-authorization requests. Briefly, we have overseas treatment, and a beneficiary can access treatment where contributions are up to date. You are a member of regular and good standing. Treatment sought is not available in Kenya, and the treatment sought is being provided by a healthcare provider contracted by the authority, and the beneficiary shall make a request for consideration by the authority. That marks the end of my presentation. I know I've spoken a lot. Allow me to pass the baton to the moderator to invite Maria Dera to take us through the benefit package. Thank you.
Wow. Thank you very much indeed. Gilbert, there's so much to learn. And as
Welcome
you
a
know,
lot, I know.
yeah, and as you went through the presentation, things are actually becoming more clear. It is so good when we sit in such a forum and get to hear what really is going on. So thank you very much. Actually, that has been very, very beneficial and all-inclusive in terms of what SHIF is all about and SHA. So I think because I know there are many questions and we are really waiting for this particular presentation by Madam Adera, because it is where we are very keen on the benefits. Let me just invite Madam Adera just to take us away through the benefits, the exclusions and the limits. It is very important to us because it's quite impactful at this stage. So Madam Adera, are you ready for us? Ms. Adera, as she prepares, please feel free to keep posting your questions. We are getting ready to answer them so that you're settled and your concerns are sorted out so that we can now be empowered to use this new facility that is quite holistic, I may say. So we just hope that after, the hiccups of implementation, that SHIF will be able to run and just be the benefit that is required for the citizens. Adera, are you ready for us? Maybe Gilbert, you can check whether her network has an issue. Is she ready now?
As we wait, we can proceed because
okay.
I can proceed. Maria, I can proceed because of the benefit package, if you allow me.
Sure thing. Please do. I like that you are the plan B. Can you imagine? So go on, Mr. Soro. I like the way you're well equipped.
Thank you. Allow me to take you where the rubber meets the road, even as I wait for Adera, my colleague, to join me. I'll take you through the Social Health Authority benefit package and the tariffs.
Thank you.
Now, we will start with the foundation. A famous English philosopher said that if you want to see the past, you want to see the future, you look at the past. How did we come up with the benefit package design? Now, for us to come up with the essential benefit package, I did indicate it followed the 2010 Constitution that indicates that there must be public participation. The first thing that was done was to identify services for potential inclusion in the benefit package. This was done by the Benefit Package Advisory Panel. Number two, they were to do costing of that benefit package. Number three, they were to get data on the population, that is the population of Kenya, and the current coverage for the benefit package interventions. They were to compute the total intervention costs and budget impact to determine what is known as the yield. Finally, they were to come up with the optimized health benefit package, which was validated with all stakeholders and a process led by the Cabinet Secretary of Health that happened at KICC. Now, allow me to talk something on the funds. When we are talking of the three funds, which are referred to as SHIA. By now, when I talk of SHIA, I imply the Social Health Authority. We have the Primary Healthcare Fund, which is funded by the government through the exchequer, whereby we have resources appropriated during the budget making process. And the benefits for the Primary Healthcare Fund can be accessed at level 2 and 3, and the benefits are for all registered members of SHIA. They may not be paid up members, but it's a requirement of the law, they are registered. The second fund is the Social Health Insurance Fund. We have individuals who it's a contributory fund for the salaried and non-salaried, and the last cohort is the poor and vulnerable. And the benefits can be accessed only for paid-up members. Last but not the least is the Emergency Chronic Critical Illness Fund, which is government-funded from the exchequer, and it's for accident and emergency services that are accessible by all Kenyans. Remember, I did indicate this gives life to Section 43, sub-article 2, that Kenyans have access to emergency treatment. Now, the benefits financed by the primary health care include the outpatient care, inpatient. For the first time, we have screening, and you'll see that when we talk of UHC, we are talking of arresting disease before it becomes catastrophic. Detection of disease before it's out of hand, we have optical services. Now, the scope of cover for the primary healthcare includes 1, management of acute and chronic conditions, that is consultation with a general practitioner. We are talking of a nurse, psychiatrist, a medical officer of health, and many others. Requisite laboratory investigation, imaging, we are talking of X-ray, amongst others. A prescription medicine, that is drug administration and dispensing. Vaccination, as per the Kenya Essential Program of Immunization, KEPI. Outpatient procedures, management of mental health conditions, and of course, we cannot talk of primary healthcare without talking of preventive promotive health wellness, counseling, antenatal care, and the postnatal care. I did indicate Mungu akileta mtoto analeta na sahani yake. At SHA, we are your trusted caring partner. And the tariff or the provider payment mechanism is the global budget capitation of 900 shillings per person per annum. So for every person who's registered to SHA will pay a block figure of 900 shillings per person per annum to his preferred primary healthcare facility of choice. Allow me to mention briefly on the access rules. Members choose choice in level 2 and 3, and for those with chronic ailment, they are referred to level 4 primary healthcare facilities for treatment. Allow me to talk of the optical healthcare services or eye services, and the scope of cover includes eye health education, eye test and treatment for refractive errors through eyeglasses. And the tariff, the limit is Kenya shillings 1,000 per household for beneficiaries below the age of 18 years. And the access rules is level 2 to level 4 facilities. Now, under the primary healthcare inpatient care services, the scope of cover is management of diseases while admitted, and it includes consultation, bed charges, nursing charges, laboratory and radiological examination, drug administration and dispensing, including post-discharge medication, what you are given to go and take home, physiotherapy, and the administration of blood and blood products. And the tariff is Kenya shillings 2,240, and you can be admitted for a maximum of 180 days. The other key aspect is screening services, which is a new thing. And the scope of cover is that screening will be done as part of the initial assessment to identify potential health concerns that require further evaluation or immediate attention, and to be financed under the outpatient services. The access rules is screening for common health conditions to be financed under the outpatient services, and the targeted screening for the top 4 cancers with the highest incidence rates. We are talking of breast, prostate, colon, cervical cancers will be rolled out in year 2 on the maturity of the fund. So a take note is that screening will commence after year 2 after maturity of the fund. Let's talk of services that are available under SHIF. Under SHIF, we have the outpatient care services, inpatient care services, maternity, neonatal, and child health services, renal care therapies, mental wellness, the highly patronized surgical benefit package, the oncology benefit package, which is known as cancer, medical imaging, MRI, CT scan, PET scan, and other diagnostic services, and overseas treatment. Under the outpatient benefit package, the scope of cover, it includes the essential diagnostic laboratory investigations for diabetes, hypertension, sickle cell, asthma, with an aim to build a chronic disease registry. The tariff for diabetes, SHIA will reimburse Kenya shillings 4,300. For sickle cell, 6,800. For hypertension, 2,850. For asthma, the test we shall reimburse at 700 shillings. For the access rules, the limit is 1 per year per person, and SHIF will pay up to the specified tariff members to top up for any additional services. Now we'll go to inpatient care services, and the scope of cover includes management of diseases while admitted, bed charges, consultation charges, nurse services charges, laboratory investigation, radiological examinations, drugs and post-discharge medication, physiotherapy, and administration of blood and products. When it comes to the provider payment mechanism, we also call it per diem. In level 4 hospitals, it's 3,360. Level 5, 3,920. In event you're admitted in level 6, which are teaching and referral hospitals like Kenyatta or Moi, it is 4,480. And the access rules or the aggregate limits of liability is 180 days per household. For the maternity, newborn, and child health services, the scope of cover includes antenatal care, normal delivery, cesarean section, postnatal care including immunization for the newborn, postnatal family planning, management of postpartum infection, management of neonatal complications, anti-D serum for rhesus negative mothers. And the tariff is for normal delivery and essential newborn care is 10,000. This has been increased, and for the cesarean section and essential newborn care, it's been increased to 30,000. Now, for the access rules, it's available in level 2 to level 6 facilities, and for antenatal care and postnatal care, services are covered as outpatient services in level 2, 3, and level 4 facilities. For renal care services, dialysis, the scope of cover includes consultation, temporary catheter insertion and removal, laboratory investigation, the nursing care and the dialysis services, medication, dialysis, and other dialysis protocols. And the tariff, which has been increased for the hemodialysis or hemodiafiltration, it's been increased from 9,500 to 10,650 at a maximum of 2 sessions per week. For peritoneal dialysis, which is a new entrant, it is 85,200 per month, where the member will top up any amounts that exceed the limits of liability. And the access rules is facilities with the capacity to offer that services. We'll go to the renal care services. We are talking of renal replacement for patients who ill from the end kidney disease. We are talking of kidney transplantation. And the scope of cover includes the pre-transplant evaluation for the kidney donor, the kidney transplantation, and the post-renal replacement therapy, including medication. And the tariff for the pre-transplant recipient evaluation for the donor, the limit of liability is 150,000 per household. For the recipient surgery, it is 700,000. For donor nephrectomy, that is the surgical part whereby they remove a kidney, it's 168,000. Post-renal replacement therapy, we've put a limit of 200,000 for the post-discharge medication. And for the access rules, it's facilities with the capacity to offer the services. I'll go quickly to the mental wellness service, which was previously known as the drug and substance abuse and the mental health benefit package. Sorry, for the scope of cover, we have mental health education, counseling and psychosocial support services, screening, behavioral disorders, neurodevelopment disorders, neurodegenerative disorders, and affective and psychoactive disorder rehabilitation for substance-related addictive disorders, that is drug and substance abuse. We are talking of depression, schizophrenia, amongst others, and the tariff is for the outpatient services within the primary healthcare outpatient cover. For inpatient, it is the provider payment mechanism whereby we are paying per diem. For rehabilitation for drug and substance abuse package, is Kenya shilling 67,200, where the member will top up any amounts that exceed the cover limit. The access rules is that for diagnosis and management of behavioral disorders, inpatient shall have a limit of 180 days per household, accessible in level 2 to level 6 facilities. For the surgical benefit package, which is highly patronized, the scope of cover includes admission, minor, major, and the specialized surgical procedures, where we are talking of organ transplants, management complications, post-procedure pain management, physiotherapy services, critical care services related to the surgical procedure, and immunosuppression services for organ transplants. The tariff is the provider payment mechanism whereby it is fee for service at a fixed rate. The access rules is facilities with the capacity to offer that services, and the limits of liability for minor services, for minor surgeries, it's 3 minor procedures per household per year. For major procedures are 2 per household per year, and 1 specialized procedure per household per year for organ transplants, amongst others. The hematology and oncology services, the scope of cover includes chemotherapy, radiation therapy, hormonal therapy, and immunotherapy. It also includes laboratory investigations. We have red cell exchange, radiological services, surgical interventions, and management of precancerous lesions. And the access rules is facilities with the capacity to offer the services. And diagnosis, staging, and treatment, the limit is 400,000. and it's pre-authorized services whereby approvals for oncology services will be granted as per the Ministry of Health guidelines and the National Cancer Treatment Protocols for adult and children cancers differentiated in care models. I'll go to diagnostic imaging and other investigation. The scope of cover includes MRI, CT scan, CT angio, mammography, fluoroscopy, echo, EEG, and specialized ultrasounds. The tariffs are MRI, which is 11,000, CT scan 6,900, CT angio 8,000, specialized ultrasounds, which are also known as Dopplers, at 5,500, and EEG at 8,000 for a child and 5,000 for an adult. For mammography, it's 3,000. Fluoroscopy, the fund shall reimburse 4,000, and echo 3,500. And the limit is 2 per household per annum, and you can access these services at all facilities which require imaging. Oral health services, which includes oral health education, counseling, screening, and consultation, tooth extractions. We are talking of dry socket debridement, suturing, and local anesthesia, gingivitis, and periodontitis by scaling and polishing. Now, the access rules is 2,000 per household, and they can be accessed where capacity is available and dental units that are willing to offer the service. Of particular note, this package will be rolled out in the second year of maturity of the fund. Overseas treatment or foreign treatment, the scope of cover is medical and surgical procedures that are not locally available. The access point for services is overseas empaneled and contracted healthcare providers, and the tariff, the limit of liability is $500,000, and the rollout will commence after 6 to 12 months after the implementation of the benefit package to allow for time for empanelment and contracting of the overseas healthcare provider and negotiations of the rate. I'll go quickly to the Emergency Chronic Critical Illness Fund, whereby the scope of cover includes the ambulance evacuation services, that is ambulatory, accident and emergency services, chronic illness services, assistive devices, we are talking of wheelchairs, crutches, pressure stockings, critical illness services, and palliative care services. Under the ambulance evacuation services, the scope of cover includes evacuation from the point of incident to the nearest empaneled and contracted facilities, and the transfer of patients requiring emergency and further clinical care from one low-level facility to a higher level facility, from level 2 to 3 or from level 3 to 4. And the access point for services is management of all transfers, evacuations through the National Ambulance Call Center. There shall be established a National Ambulance Call Center that will be used for purposes of requisitioning this service. And the tariff is for the first 25 kilometers radius, intrametro, SHIA will reimburse Kenya shillings 4,500. For any extra kilometer beyond 25, they'll pay 75 shillings per kilometers. And the access rule is accessible by all Kenyans, irrespective of registration or premium status. Under the accident and emergency services, the scope of cover includes cardiac and pulmonary arrest, major trauma, shock states, altered level of consciousness, seizures, chest pain, that is stroke, anti-snake venom, and anti-rabies, available in level 2 to 6 facilities, and the tariff is fee for service. And the access rules, it's accessible by all Kenyans irrespective of their registration or premium payment, and care offered up to a maximum of 24 hours, after which SHIF benefits are activated for paid-up members. Critical illness services, they will cater for critical care admissions in critical care units. And these are available in level 4 to 6 facilities. And the provider payment mechanism is per diem rate, same as inpatient benefit package, where the member will top up amounts that exceed the cover limit. And the limit, the aggregate limit of liability within inpatient bed days, 180 days. Palliative care services, this benefit aims at enhancing the quality of care for patients with serious chronic or life-threatening illness, which include management, psychosocial support, caregiver support, and end-of-life care. The access point for these services is level 3 to 6, and the tariff is the per diem rate, same as the inpatient benefit package. And of course, the limit of liability is 180 days. Assistive devices, provision of assistive devices to support patients with permanent physical or sensory disabilities, and the progressive chronic conditions such as Parkinson's disease and multiple sclerosis. Access is level 4 to 6, and the tariff includes the following. Number 1, hearing aids. Number 2, wheelchair at 15,000. Therapeutic footwear at 1,000. Walking frames or crutches at 500. Club foot brace at 1,000. And crutches at 900. Now, access rules. Hearing aid is limited to individuals aged 18 years and below, and they can only be issued once in a lifetime. And take note that the package will be rolled out in year 2 upon maturity. Quickly, I'm winding up on exclusions. We are talking of exclusions that are not payable by SHIA. They include cosmetic procedures, unless specified in surgical listing, treatment by chiropractors, herbalists, acupuncturists, they are not payable. Assisted facility treatment, IVF, or other procedures, vaccines other than those prescribed by the Kenya Expanded Program of Immunization, KEPI, products outside the Kenya Essential Medical List and the Kenya Essential Diagnostic List, weight management drugs, medical costs related or incurred in research environment or clinical trials, epidemics and pandemics, professional fee for medical personnel over and above the prescribed rates, expenses related to diagnostic equipment, including but not limited, such as glucometer or a glucose machine, other products or interventions not listed in the scope of the benefit package. We have vertically financed programs, which include ARVs, anti-malarial, anti-TB, associated tests, family planning commodities, KEPI vaccines, will continue to be provided at public and faith-based private facilities that report to the health information system. With those very many remarks, I humbly submit and kindly request to rest it there. Over to you, Chair.
Thank you very much, Gilbert. That was amazing. You did it quite well. Very intense, very demanding, but very well done job. Thank you, sir.
You are most
We shall
welcome.
allow you to take a few minutes, maybe have a cup of tea quickly before you engage with us in terms of our questions. We have a lot of questions. For those of you who have joined in a bit late, we are on Conversations with Esther, and today we are demystifying Social Health Insurance Fund, which we like calling SHIF. We also talked about the Social Health Authority and the Social Health Insurance Authority to SHIA, SHA, and SHIF. And we've had a really, really interesting and engaging half hour just getting to know about how to register, how to get ourselves onboarded, and also a very critical area which everyone is really keen on right now. What is there for us in terms of the benefits that are offered in this enhanced program that took effect on the 1st of October
We've lost
Sorry
the
about
mother.
that. I'm back. Thank you. I hope you can hear me now.
We get you loud and clear.
Thank you. Sometimes Mtandao brings these kind of issues, but we are on board. We are going to do this together. Because of time, I'd like us to go to the questions. Gilbert, have you had your cup of tea or your favorite drink?
Yes, I'm ready. You can kindly raise
We
the
can do
questions. I
it,
didn't
eh?
have time to look at the wall, but I'm ready to
Yes,
answer.
I
I
will
could
do that.
actually also support him. I'm
Yes.
Oh,
back on
Maria
my
is here.
Oh,
network was
Marie, you
so
made
bad.
it.
Yeah, it went off
I
the network.
I understand. We are also having the same issues. I guess it's because of the rain. We had been promised some rain this week, so we are grateful for the rains. We shall get this done. So, Miss Adera, thank you very much that you'll be able to support our brother. So, I think maybe let me start with the first questions that, first of all, related to the registration, and then we can now go and tap around to the bits on benefits. Now, there are so many questions. We may not be able to go through all these, but I know Esther will give us another chance to still talk matters social health insurance fund later, maybe next time, because there are many questions, there are many concerns, and we want everyone to feel empowered and supported. So the first question that I have, maybe Marie, you can take this one, is can a person who's registered as a SHIF member get a refund after paying cash in a hospital due to the current implementation hiccups?
Okay, I'll answer that. Yes, it's possible depending with the dynamic of how you ended up paying. Most of like the time during the crisis when you were transitioning, you'll realize a lot of members were already those that issue of the system. So those are announcement which was done, but it is subject to you submitting to the nearest SHA offices. You attach the medical reports, you attach the invoices that you had paid with, together with a formal letter request written, submit to the nearest branch. Then from there will be guided accordingly how the reimbursements will be done on case-to-case basis.
Thank you, Marie. Is there a timeline that you give yourself so that people are able to wait with an expectation in terms of timelines?
Normally, in the past we used to have the same. Normally it takes 30 to 60 days, but for now, because it's a new, with the new dispensation, we've
Yes.
still not been given clear-cut guidelines, but those are media breakdown news, which they encourage most of those who are in critical state, like the dialysis
Yes.
cases. You remember that was the media.
Yes.
It was advised for such dynamics, members just lodge the claims to the nearest branches, shared branches or former defunct NHIF offices, and then from there, as long as you have the supporting documentation, they'll all be put together. Then they'll be reviewed on case to case as they process them.
Thank you, Marie. At least that offers us some comfort.
Yeah.
So members, please feel free to log in, your claims, but as much as possible, let's try and follow the setup as is. So the next questions, maybe to Gilbert or to you, Marie, what happens when 14 days lapse before the registration of a minor? This goes back to the first presentation where we were talking about registration.
I think Mr. Soro will answer that one. She is more good in registration and compliance. I can take the clinical, anything touching on hospitals and benefits. Also, over to
Gilbert?
you.
Thank you. Now, on the issue of the timelines, I did indicate that upon birth of a newborn baby at the age of 7 days, 14 days rather, they are supposed to be, the caregiver parents are supposed to go to the nearest SHA point of service to register this newborn baby as a minor. Now, after the lapse of 14 days, it does not mean it's the end of the road. We normally appeal to our members so as not to miss the USC objective of leaving no one behind. to ensure that that baby is registered, because we do not want a scenario whereby the newborn babies cannot access services because they are not registered. So all is not lost. After 14 days, you can create time at your own time, which is appropriate to go to any SHIA point of service to register that baby. There are no penalties. Thank you.
Gilbert, I think it's also good because there is a couple of questions on where these SHIA points of service are. Could you maybe clarify, is it the offices, is it at the Huduma centers, is it at the hospitals? Maybe give us clarity so that people know where to go.
Thank you. On the issue of SHIA points of service, currently, SHIA has a branch network of full-fledged branches. We have 70 branches that are spread equally in the entire Republic of Kenya, and they're available at all county offices. Apart from the 70 branch offices, which are the main offices, we have satellite offices, which are small offices that are used to assist people in far-flung areas. And we are talking of in excess of 54, not 54, 33 satellite offices. Then SHIA has presence in 54 Huduma centers. So you can either go to Huduma center, you go to a branch office or a satellite office where you can be able to access our services comprehensively. Thank you, Chair.
Oh, thank you very much. That should be quite exhaustive. We are well covered. Thank you for that. Now, the next one is still on registration. So Gilbert, still stay right there. Just take a sip as I ask the next one. How is the mean testing conducted to determine healthcare contributions? Is it fair? Is it reliable?
Thank you. Now, I did indicate the issue of means testing. That the SHIA will use means testing to be able to determine first to determine households that are in need of financial assistance. The second use of means testing is to determine the premiums payable by the non-salaried households, Mama Mboga, Juakali artisans, Boda, and many others. Now, this means testing tool was developed by the Ministry of Health and the State Department Social Protection. And it is a tool that assesses the income and assets of a member to determine the premiums payable. You will be expected to answer 20 questions that are available on the portal. For purposes of this team, when you register during registration and indicate that you are non-salaried, there is a drop-down button that will take you to means testing. So after you answer those 20 questions that include, among others, the type of house you live in, whether it's a walled house, mud walled house, the type of roof, whether it is asbestos, galvanized iron sheets, whether you have animals, the acreage of the land, amongst others, it uses a linear regression formula to come up with a scientific method of seeing what you can financially sustain to pay as premiums. So I want to appeal for those of us who have parents in the village, relatives, to encourage them to subject themselves to proxy means testing. Allow me, Chair, to mention, to take a deep dive on means testing, because people ask me, why means testing? We've come from a regime under NHIF where people were remitting premiums on a graduated scale, the minimum being 150 and the maximum was capped at 1,700. To ensure that we comply with the objective of UHC, which talks of equity or standardization in terms of contributions, it was noted that there was need to standardize contributions. We were coming from a scenario, a rich Kenyan a corporate guru earning 1 million shilling is contributing an equivalent of 1.12%, while another one earning the minimum wage is contributing 5%. I normally give a typical example of this. One person earning 100,000, if you are to apply the formula of 2.75, ordinarily should pay 2,750. The one earning minimum wage, who is about earning 10,000 shillings, should pay 275. But we are punishing the poor or punishing the poor to reward the rich. That is the philosophy behind means testing. So look at it from that perspective to bring equity in contributions. Thank you.
Thank you, Gilbert. I'm just looking at access to the portal, and especially for many who live in the rural areas. I guess maybe it will be advisable maybe for them to visit the SHIA offices when they are doing this when they're using the mean testing tool. It sounds quite a bit complex to me, but if it works, so be it, so that we have that universal coverage and in an equitable manner.
Now, we have made it simple because the government has recruited in excess of 107,000 community health promoters who have been given gadgets, tablets, to assist members of SHIA undertake proxy means testing. So they've been given a target of 100 households, which they'll visit and assist the elderly, the not tech-savvy people, to undertake means testing. Thank you, moderator.
Thank you very much indeed. Quite interesting and complex. We are getting a lot of information. Please also, our participants, note that Gilbert and Marie are also answering some of your questions on the chat. We have so many questions. We are going to try and cover as much as we can because we wish to close at 8:30. I know you have had a long day, each one of you, but I promise Conversations with Esther are hearing what you're asking, more time. So I think we shall organize to have another session, but in the meantime, let's still utilize our 15 minutes. I think let's now go to a different one, a different question, maybe to do with the benefits. So one of us is asking, if I exhaust my inpatient limit under the primary health care fund, do I automatically then benefit from the inpatient benefit under SHIF? Is that Marie who will take that? Because, okay, it's not very clear to me, but I hope it is clear to you.
Yes. Okay. Under the inpatient, you'll realize based on the presentation that Mr. Osoro has just shared, it cuts across. The only difference is that it depends on the level of the facility. Like for level 2, there's that inpatient to treat the basic kind of essential conditions like maybe malaria and all that, those communicable conditions, which can be treated at a primary care level. However, it doesn't stop that primary care level taking you to a higher facility level where you find most of those level 4, 5, and 6 are under SHIF. So you are comprehensively covered in that angle, in that manner, and it cuts across. So level 4, 5, and 6, you'll realize that the rebate, as you go higher, rebate goes higher. It has been kind of standardized. So it cuts across all, whether you go to level 4, 5, 6, so long as you're doing your statutory deduction. However, the other thing also wanted to demystify that under the primary health care, it is fully funded by the government. So whether you're paying your SHIF or you're not paying your SHIF, you'll still be entitled to access those services. But it is open up to level 4, 5, and 6, of which most of these inpatient facilities are under the SHIF benefit. So you'll be able to access so long as your statutory deduction is up to date. The other thing I also wanted to emphasize that if you've realized also, based on the sensitization that Mr. Osoro shared, the only limit that has been capped is up to 180 days. Just as what the former defunct NHIF used to give. That is the only, anything over and above, then the member tops up. At 180 days, we will pay all those rebates, or depending with the number of days you sleep in the hospital. Any form of inpatient rebate will apply, including mental health conditions. Rebate will apply. We will fully cater for it, so long as it's up to 180 days. Thank you. Over to you, Ms. Grace.
Thank you so much, Marie. That's comprehensive. So it has to do, of course, with the level of the facility. And we also appreciate the fact that you have put in place, support for conditions that have been left out earlier on in the NHIF scheme. So well noted, especially on mental wellness, that there is emphasis on that. And I was also keen to note the bit on the screening, which is better, the preventative before we get to the curative. So Gilbert and Marie, that is also a well done. Now, on a light note, I think maybe there's this one which I think we can, bring on board just to break the ice, where someone says, NHIF, I think they mean SHIF, NHIF had a bias for civil servants who benefited while the private sector paid without benefits. Is SHIF different? Over to you, dear ones.
I'll answer that. I wish to also demystify that statement of
Yes.
being biased. Reason being that the normal NHIF, it was just a normal statutory deductions which we used to cut across to everybody. However, for like civil servants, on top of that normal statutory deduction that they used to give, there was also what you call a medical outpatient allowance, which used to be in their payslip, which was also removed. And then on top of that, under Public Service Commission, they used to also add extra premium to give what we call a comprehensive cover, like more or less like I'll give a good example like AAR or fast assurance, whereby we are able to give more benefits because you're also contributing more. So let's assume like maybe you are contributing like 6,000.
Yes,
right?
Marie.
Then on top of that, maybe there's that statutory which comes to about 70,000, which is being deducted annually.
Yes.
Then on top of that, government tops up for you maybe around 20,000. So you see, you'll have contributed 3 times: the 6,000, the 70,000, and maybe that extra 20,000 that government gave them was topping up for them to give them what you call a comprehensive insurance cover, like what private insurance used to give, which used to be under a section called managed scheme, which we used to call managed schemes. So basically because of that extra premium that they were contributing to give more benefits. So yeah, but with the new transition, realize also they've stated very clearly that no managed schemes will now be taken over by SHIA. Instead, they should manage scheme. And they're also trying to harmonize to bring that aspect of equity. That is also another factor that has made it even more unique as compared to what we used to have. In the previous one, we used to have 2 schemes: the normal national scheme, the managed schemes, which used to make it a bit more comprehensive compared to the national scheme. But nevertheless, we tried to give equal opportunity to all. What mattered most was how much were you contributing extra to get those extra benefits, or rather extra premiums to get the extra benefits. Maybe Osoro can add.
Okay. It seems Gilbert is away, so there's that.
Maria's answered it comprehensively. It's all right.
Okay. So it's to bring in the uniformity and the universality, so to speak. There's this other question. Under SHIF, can I choose where I want to access medical care?
Actually, what is happening right now under SHIF, the determinant will be your location. You see, when you
Yeah.
at the point when you're doing your registration, you are also expected to choose a location where you stay. So basing on, let's assume like maybe I live in Embakasi, Garrison, where I will have selected the first, where I will be automatically, the system will give me options of the facilities which are near me to enable me now choose. Unlike in the past, whereby one could even be here, then you choose somewhere else. So the determinant is at the point when you're registering, where is your location? So that now it automatically filters you now to the nearest primary network facilities, which you'll now be entitled now to, which now will give you the option of where you want to be, maybe amongst the 3 facilities that are near you. So it will be based on per head and where you stay, your geographical location where you stay. That is what makes it unique. Perhaps
Great.
Mr. can expand more on the same.
Mr. Osoro?
Maria, yes, let me just add on what my sister Maria said. For the outpatient benefit package, primary healthcare, and PHC and SHIF, once you make an application to SHA, it will request you the county, sub-county where you stay. The purpose of SHA requesting this information is to automatically capitate you to a primary care network. And I want our listeners to understand we are talking of a network, which is a group of very many hospitals. A case in time, if you're in Upper Hill and you indicate you reside in Upper Hill, you'll be allowed access to level 2, 3, 4 facilities within the entire Upper Hill area. So the choice of facility is dependent on your area of residence. I hope we are very clear. On issues pertaining to inpatient under SHIF, you can access any healthcare facility as long as it's empaneled and contracted and you follow the guidelines.
Thank you. Thank you, Gilbert. So it's for us to make sure that we are equipped in checking whether these particular facilities that we are going to are already onboarded with SHIF. Is that true?
Very true.
Excellent. That's quite straightforward. Now, I think because of time and our presenters have done an awesome job, but I know it has been quite a stretching discussion. Maybe we take 2 more questions. I know some of you are commenting that we have not gotten to your questions. Apologies. There are many questions. We are trying what we can just to cover each one of you. Please don't feel left out. We really care and are concerned about your communication and feedback. As I'm saying, conversations with Esther, we'll think of having part 2. I think Marie and Gilbert, you can see the flood of questions and concerns. Your customers are asking for help, isn't it? We are your customers, we are your clients. So we would like to have more of this, and hopefully we can come up with something next week. So one or two more questions. So thank you for the presentation. For the NHIF members who had paid for a whole year for the insurance premiums, will they be able to utilize these amounts in SHIF, or there'll be a change? I think that one, Gilbert, spot on you. Go, please take us on. Yes.
And actually, I posted in the chat, I did indicate for the members who have made prepayments upfront for 2-3 years, because we have instances where members who are seeking pre-authorization for specialized treatment, like cancer and many others, they were normally encouraged to prepay. What SHA has done, they will reach out to those members to subject themselves to proxy means testing. Once they are certain the premiums payable by this member, they'll be spread out on equal basis until the amount is exhausted. Long and short, SHA will ensure seamless access to service and no money will be lost by our esteemed members in the process. So rest assured, your money is safe and sound. Please encourage those people to do means testing to enable SHIA spread the amount based on the premiums they're supposed to pay. Thank you.
Thank you, Gilbert. We are your customers and we are listening very closely. We want service and value for our money.
Amen.
So be
We
ready
are
for
ready
us.
and willing. As I said when we started, to whom much is given, much more is expected.
Absolutely. And I'm glad that we have the likes of Marie and Gilbert taking care of us at SHIF. It gives us a relief. Maybe, as just maybe to interject, I'm not a health expert, but whenever you're launching any project or assignment, of course, there are teething problems and a few unknowns. But I think at the pilot stage, then you are able to come up with solutions as we move step by step. And this brings in the question of the relief, the medical insurance relief. What about that? Because there was earlier on a communication that we would have relief, but later on there seemed to have been a bit of a gray area. Could you maybe take that as the last question before we leave?
Yes, I want to respond to that very important question. When you look at the Income Tax Act, Cap 470, Laws of Kenya, Section 31, Article 4, it reads that for members of regular and good standing of the National Health Insurance Fund, they'll be entitled to tax relief at a rate of 15%. Now, the wording of that particular sentence is very clear, that it is only limited to the National Health Insurance Fund. I know people have been asking, well, what is the way forward? And recently, I saw something that did indicate that there is a process that is ongoing at KRA, that they want to amend the law so that it reads expressly that the tax relief will be applicable to the Social Health Insurance Fund. But I don't want to call it official because I also saw it being circulated, as you said. We are waiting for further direction.
Thank you.
I want to rest it there.
And we shall not push you further than that. I don't know, time, one more question. There's somebody who's a bit, distressed over their children over 18 years. Maybe could you comment about that one? Then we can close because it's been quite an engaging discussion. I know we have many, many questions, many concerns, comments, but I think we have done very well in the last 1 or so hour, and we can still meet again and organize maybe next week. We'll look at the administrative bits of it, and then we can still continue with this discussion of demystifying the SHIF. So, Mr. Osoro or Marie, could you say something about children over 18 years and are still in school? How do we onboard them? What happens? Do they continue on like the insurances where they say between 18 and 25, you can still be on, your principal member's account? How are we doing it? Maybe you can go back again because you had mentioned it earlier on in the presentation.
I want to tell the audience that under SHIA, we say children are a blessing from God. After they attain the age of 18 years, SHIA has provided a reprieve for the principal members whereby if those children are in a full-time post-secondary institution, either a polytechnic, a college, or a university, that is registered with the authority, with the ministry, then they can continue accessing the benefit package up to the age of 25 years, whereby they'll be treated as a separate and independent household. So take heart, you have your back covered. Thank you.
Thank you, Gilbert. Friends of Conversations with Esther, it has been a beautiful night. Thank you very much for your engagement. I especially want to say thank you to the professionals from SHA. Gilbert and Marie, you did service to your agency. Thank you very much indeed. And to all our participants on CWE, I mean, we can't keep up. Thank you for being present, even in the rains. After a long day, you've stayed patient. I know some of you still have very many unanswered questions. We are going to have another session. We shall go back to our service providers and ask them to just be with us at least next week. So with our friends, I request that maybe you can, our QR code is on your screens. Please scan and you can follow us and also just get to listen through and learn, because everything will be on YouTube. Please feel free to do that. And with that, I want to say thank you very much to the team for from Conversations with Esther, and especially Leah, who's been with us in the background, Madam Esther, our founder, following in her own quiet way. And once more, Gilbert and Marie, you did well. Thank you very much. It's from me, Grace. I wish you good night and God bless, a productive and a healthy week ahead. Ciao.
Thank you and God